Hello everyone, my name is Gayatri. Today I'll talk about a case of leprosy caused by a bacteria called Mycobacterium lepromatosis. This is a rare type of leprosy, and the case helps us understand how the disease looks, how it is diagnosed, and how it is treated. I will walk you through the patient story and the public health lessons. Coming to the patient's profile, the patient was a 25-year-old man who lived in Minneapolis but was originally from Guerrero, Mexico, which is an area where leprosy is more common. He came to the clinic after having symptoms for 1.5 years. He felt itching, swelling, and pain in his hands, feet, and ears. He had no major past medical problems. Um, During his exam, doctor noticed loss of eyebrows, which we can see in this uh, picture, and eyelashes, swelling of his ears, hands, and feet, and dark, slightly red patches on his arms and legs. The skin changes were on the arms and legs, but not on the chest or trunk. At this time, he did not have nerve problems yet, which is important because leprosy often affects nerves. Coming to the lab results, his blood test showed signs of inflammation. He also had some confusing results like a borderline syphilis test and a positive ANA test. Because the results were not clear and his symptoms were unusual, the doctor decided to do a skin biopsy to find out what was really going on. So the skin biopsy was very important because it showed a lot of immune cells, inflammation around nerves and blood vessels, a large number of acid-fast bacteria, which are the bacteria that cause leprosy. Based on this, the doctor diagnosed him with a borderline lepromatosis, leprosy caused by Mycobacterium lepromatosis, which is a newer type of leprosy bacteria that was first recognized in Mexico. Coming to the initial treatment, he was started on multi-drug therapy, which is standard therapy for leprosy. His medicines included minocycline, sorry, rifampin. I'm sorry for my pronunciation. Dapsone, and using several drugs at the same time helps stop the bacteria and prevents resistance. The goal of the treatment is to cure the infection and stop nerve damage. About 11 months later, he developed a strong reaction called ENL, erythema nodosum leprosum. So he had fevers, painful red bumps on his arms and legs, swelling of hands and feet, joint pain, and some numbness and mild weakness in his hands and feet. He also had a bluish color on his nose and ears, which was a side effect of minocycline, so that medicine was stopped. To control the reaction, the doctor used pyroxine, a steroid, and pentoxifylline to help reduce inflammation. When the reaction did not improve, they added clofazimine, later thalidomide, which works very well for ENL. He stayed on these medicines for years with the doses adjusted based on his symptoms. After long-term treatment, the patient improved a lot. His nerve problems went away. His skin looked much better. Only few bacteria were left in the skin. He continued taking low doses of thalidomide and pyroxine to prevent new ENL flare-ups. This shows that even very serious leprosy cases can be managed well with a proper care. So Mycobacterium lepromatosis is found mostly in Mexico and Central America. Leprosy spreads slowly, usually through a long-term close contact, likely through the nose. The incubation period is long, often 5 to 7 years, so people may not know when they got infected. People who come from areas where leprosy is common are at higher risk, which explains this patient case in United States. So key lessons from this case are early diagnosis help prevent nerve damage, treating with treating with multiple drugs is important. Reactions like ENL must be recognized quickly and treated. Close contacts may need to be checked. Public health workers should know that leprosy can still appear in the US, especially in people who have moved from endemic countries. Prevention includes early treatment, screening, contacts, and education. So, in conclusion, this case shows how leprosy can be hard to diagnose and manage. This patient needed a long-term treatment, but he improved with the proper care. Understanding this disease helps both doctors and public health workers, provides better care and prevent future cases. Thank you for listening. And these are the references I used for this case study. Um, Thank you again for listening.